Hello everyone. I hope you're doing well. Today it will be an introduction uh, on pathological physiology. It is the first lecture today. We will explain everything from the introduction of the pathophysiology until the end of this subject. So I hope that you all gonna enjoy with me. First of all, guys, pathophysiology. Uh, what does it mean? The word pathophysiology. Patho, it's mean the illness or the disease. Physiology, we already know the term physiology or physio. It's the nature, and ology, it's the science. So it's mean the studying the nature of the disease. We will start from the general nosology. Noso or nosology, it's the science of also studying a disease. It's a subtitle of the pathophysiology. As well, you know, I will be with you. My name is Muhammad Yaman Al Hassan, and that's my ORCID number. For who is interested in my research and articles which I'm writing. Here, if you are interested to download this lecture, you may find it in this barcode. Here there is like some of the scientists, which they are like too much, there's too much information according to them. From physiology and pathophysiology. I will not like go too much further to explain about them, but I may tell about Rudolf Virchow, which he is like right now, as we all know, he is the father of modern, modern pathology in general, and as well Elizabeth Blackburn. She's like Australian American molecular biologist. She got like a Nobel Prize in 2009. Okay, the term pathology, it was a science which like explain physiology or the pathophysiology and path anatomy. But after that, the scientist has separate those science into pathophysiology and path anatomy. What's the difference between path physiology and path anatomy? Path physiology, studying the disease during the life of the patient, let me say. But path anatomy is studying the autopsy or studying the disease, which they were the reason of the death. So that's what I can tell as comparing between those science. The aim of studying pathophysiology, before that, pathophysiology, it is an experimental science. What does it mean, experimental science? You know, guys, all the like the illness or the disease, we studied them as an experiment. We have no idea about how the mechanism, how the disease can be developed. So all the diseases, all the illnesses has been experiment into the on animals. For example, the diabetes. To study the mechanism or like the development of this disease, scientist has made an experiment into laboratory animals. For example, they removed the pancreas, and after that they returned the laboratory animal to the life, and they continue studying the mechanism of the diabetes. So the aim of this science identify the alterations in normal physiological process that occur in a disease. It's also very important to mention that it will be too much hard to understand pathophysiology without understanding the normal physiology. Also, one of the aims from the pathophysiology is to understand the reasons, the risk factor, and what's like triggers of various disease in general. As well to understand or to discover the outcome of this disease. What else? As well to develop strategies for prevention or to make a diagnosis like in general, and to find or to reach a good treatment for this disease or any disease that we are working on. As well to develop the healthcare association in general. Basic concept in pathophysiology. The first concept I can tell, it's the homeostasis and its disruptions. And we all understand from the previous course of normal physiology that homeostasis refers to the body's ability to maintain a stable internal environment despite external changes. That's an example according to the homeostasis. Here, an illustrative example of homeostasis, you know, that I just need to show using the laser. You know, here there's according to the anatomical of the brain, there's a cortex, subcortical, as well pons, the brain, medulla oblongata, or the high center control to control all the viscerals or the organs, musculoskeletal, or sometimes systems as well. Etiology and risk factor. I just want to show some etiology and risk factors. Before I'm gonna take an example, there is a biologic agent, all the microorganisms, virus, bacteria, fungi, protozoa, and extra. Physicals, there's a trauma, burns, radiations, as well chemical agents, alcohol, asbestos, poisons as well. There is the third factor, nutritional, some for example, high level of LDL or low level of low density lipoprotein, cholesterol. As well, there is excessive sodium causes make hypertension. Deficiency of some nutrients, for example, vitamin A, which can make or occur as an night blindness. Thiamine deficiency causes a peri-peri syndrome, the inflammation in the heart and in the nerves, and deficiency in vitamin C, and so on. Genetics factor, for example, in a type 1 of diabetic mellitus is caused by deficiency of TR3 and TR4, and hemophilia A is caused by deficiency of clotting factor 5 111 extra. Let's here take an example according to the risk factor of diabetes. We all know, guys, that the etiology as a term refers to the cause or the origin of this disease, the root of this disease. So if we can explain right now the causes of the diabetes, we can also speak about genetic factors. You know that if there is one of the members, close member of like me or any one of you, there is a risk factor to be also involved to get diabetic, especially for type 2. Infection factors, right now there is a new research can tell that the infection by strains of enterovirus or cytomegalovirus have been linked to an increased risk of developing diabetes, especially for the type 2 also. Environmental factors. When there is like an exposure to certain environmental factors, pollutions, being exposed to toxins, that also can be a factor to increase the diabetic factor. As well, lifestyle related factors, processed foods and sugary, like very high level of sugar as well, lack of physical activity, overweight, that's also can be a risk factor to increase factors of diabetes. Here there is special words I have to tell from the words etiology. There is pathophysiology reaction. Pathophysiology reaction, it can be any reaction appear after any disease or illness. You know, in the normal physiology can be like too many reactions. I will take an example about the pupil. When I'm like lighted, like if I want to examine a patient's eye, I'm using a special light to examine the contraction or dilation of the pupil. In the normal physiology, in the light, there's a contraction, you know, and like in a normal environment, there is a dilation. In the pathogenesis, it will be maybe the opposite. If I make a stimulation for the light into the pupil, there will be, for example, dilation. There will be no reaction. But in this case, there is a reaction. It doesn't mean like bad reactions or negative reaction. So that's the physical pathophysiology reaction. As well, there is a second place or second term, pathophysiology process. The pathophysiology process, which mean the roots, the base of all the illnesses or the disease. For example, inflammation, allergy, hypoxia, and so on. For example, the inflammation can be appearing everywhere. In the skin, stomach, heart, lungs, even like systematic circulation system or pulmonary system, urinary system as well. The third moment is a state which is from the name state, yes, which mean a case or a result of this process where we gonna live with it all our life. It will live with us until the death. For example, if someone has been burned, has a burn in his skin, for example, maybe there will occur a scar. This scar will live with this person until the death, or like if there is like inflammation into the eye or like any damage for the eye, maybe the result will be an blind. So this blindness, it's a state. So more again, pathological reaction, we explain about it. Pathological process, the base of any disease, and we gave an examples. As well, the third word, it is the state, established case or established results will be forever with the person. The second moment, pathogenesis. As a definition, pathogenesis is a sequence or a serial of cellular and tissue events that take place from time of initial or a primary contact with etiologic agents until the ultimate expression of the disease. Okay. You know, that's from the etiology. We say there is many factors to the etiology, and here in this picture I just put some examples. There's like genetic factors, lifestyle, as well here smoking, infection, some like disease from the stomach. With the time, like the pathogenesis, we say that it's sequence, like a group of many factors appear like from the primary or the initial contact with the etiological agents. Here, cause an inflammatory, and the end of this one has a result into the fibrotic disease. And here, like pathologically, we can see this slide how myofibroblast has started, fibroblast into the myofibroblast, as well continue it as a state of this fibrosis. Here I'm just like explaining an example about the pathogenesis, and I just put the lung cancer as an example. Here, more again, I just put the explanation of the pathogenesis as identification. Here, as well, the etiology. In the case of lung cancer, genetic factors play like a crucial role. There is like some variations of genetic factors can make individuals like risk factor to develop the lung cancer when there is like carcinogenous from the one member of the family, or like if there is a history in the patient itself. Environmental factors, it's also very important. The air pollution, asbestos, radon gas, like smoke, all of them like playing a role to increase the risk of developing lung cancer. Sorry. Lifestyle factors also playing like very important role in the pathogenesis of lung cancer. Smoking, tobacco, playing a role in this case, especially for the lung cancer. Alcohol also playing a role in these factors. So I hope it's like understood. Here, if you see with me, it's lung cancer has been diagnosed with MR and injection. Here we have CT scan, here under microscope, and as well here in the echo ultrasound to what I want to tell here in this picture, that there is many articles which we can use to identify the lung cancer as well. What I want to tell actually, guys, when we arrive to the life, we pass with the 3 steps. We burn into the life normal physiology, but after, if we get sick or fall ill, we turn into pathophysiology. If we recovered, we will return to the normal physiology. But if this illness or this disease has developed till the death, in this case, the person or the patient, we can identify or classify him into the patho anatomy, because after death, during the illness, during the fighting this illness, is pathophysiology, but after death is pathanatomy. It's just one point to tell you. Morphologic changes. The morphological changes can be appear into many mechanisms. For example, we will take an example here, myocardial infarction or the heart attack. Physicians can see all the changes, for example, in the ECG, even in the ultrasound of the heart. The science that's the patient is telling, or it's very clear into the patient's changes. For example, the pain into the heart, which reach the scapula, posteriorly, even to the clavicular, or a pain in the upper limb, dry mouth, weakness, fatigue, imbalance in the blood pressure. All of them can help the physicians to put the diagnosis as soon as possible. As well, we can see a cellular change. I mean, in this case, even after death, or sometimes it will be very clear on the ultrasound, especially for 3D ultrasound, especially for the ischemia. In this case, we can see that's the coronary artery, and there is a lake here in the greater veins, sinus veins. Also one sign of the MI, myocardial infarction. Cellular hypoxia, lack of oxygen. It will be very clear with the colors, the coloration of the ultrasound. Cell injury, also will be very clear when we study the paragraph of the muscles of the heart. Tissue change, especially for if there is inflammation. Inflammation can be clear with special test, maybe the hemogram or the C protein and extra. Organ changes, it will be really very clear, leading to the decrease the cardiac outputs and potential heart failure. So it will be also very clear, especially the fatigue, the general fatigue in the body. Classification of disease. We can classify the disease first of all, acute and chronic disease. There is the international classification according to the acute and chronic. There is the acutest. Acutest can start from hours maximum to 4 days. The acute from 4 days to 2 weeks. Subchronic can be from 2 weeks to 40 days. Chronic disease can be like month or months, years, whatever. Here there is like some examples, and there is symptoms can be also explain and identify, let me say, and make specific identification for the duration of the disease. Infections and non-infection disease. You know, there is like many disease caused by pathogenic microorganisms, virus, bacteria, fungi, and extra. Influenza, like I have right now, influenza. Tuberculosis, malaria. Transmission can be like a direct contact, airborne, vectors. Non-infection disease not caused by pathogenic or pathogenesis and contact like with another transmitted between individuals, you know. So it could be like diabetes, cancer, autoimmune disorders, because most of them like lifestyle choices, environmental changes, or genetics factors. Inflammatory and degenerative disease. We explained already like inflammatory disease. And again, this inflammatory disease can be characterized by inflammation or the body's response to injury or infection. We can take here like an rheumatoid fever or Crohn's disease, as asthma as well. Symptoms in this case will be pain, redness, swelling, heat as well. Degenerative disease. This can be from progressive deteriorations to or like of a tissue or organs over the time. For example, Alzheimer's disease, Parkinson disease, and so on. Yes. Let's like explain clinical manifestation to understand the sign and the symptoms of the disease. First of all, what does it mean? Symptoms. Symptoms, it's many signs can appear on the human body that telling there is something wrong, must be treated. Here I just put a picture here. I hope it will be fine for you guys to understand the reason. There is like symptoms according to the neurological, respiratory, gastrointestinal disease, musculoskeletal system, during the pregnancy, during like delivery. Each case has specific clinical manifestation or manifestation. Yes. As well, there is like a factors or like clinical manifestations according to the age, gender. There is like some disease like specific for male, for example, tumor or cancer of the prostate or testis, penis. In the woman, like uterus or vagina or cervical cancer. Okay. Okay. Steps to for the disease to be developed. First moment is like the exposure to risk factor. When like risk factor can be genetic, we spoke about the etiologies, all of them. The exposure to the risk factor increase like the likelihood of developing the disease. There is something like already has been and can be increase the chance for the person to be ill. Smoking, poor diet, genetic like factors as well. Stage number 2, it's the initiations. It's the initial event that triggers the disease process. And we spoke that about the process, yes, inflammations, allergy, hypoxia, whatever. Yes. Stage number 3, latency period. Latency period, it's like when the patient is like having the disease, but he is like asymptomatic. There is no symptoms yet. We can tell that the disease may be silently progressing with the body during this period. Stage number 4, progressions. In this case, the disease is advanced and the symptoms start to manifest. In the stage number 5, clinical manifestations. The clinical manifestations like clinical signs can be appear, and each system has a specific clinical manifestations and general for all the systems. After that, the stage number 6 is the complications. Many of the disease can or may lead to complications that arise the result of this disease progressions. Maybe it will be like an organ damage, or like can be appear as secondary infections or other like health issues. Guys, after this moment, after any disease, there will be 2 results. Even or 3, let me say 3 results. The first moment is the recovery, and in this recovery sorry, this recovery will be even complete recovery or non-complete recovery. I will not speak about the complete recovery because it's clear, but the non-complete recovery, there is like 3 points we have to tell or speak about it. First of all, we have to recontrol or recheck the patient more again, and control the signs and remake another study for the patient, or for covering maybe this illness or this disease is a chronic disease, you know. So in this case, there is no chance to help but to treat. The third moment is like when there is like too much complications for the patient, and this disease like reach the death. In the pathophysiology, the death is very important to tell about. Very clear moment that's when like the development of the embryo start, the first part of the neurology start the spinal cord and reach to the medulla oblongata, brainstem, pons, subcortical, and cortex in the end. In the death, it started the opposite. The first moment of the death is like a switch off, let me say switch off of the cortex. In this case, most of the organs or functions will be also switched off, like blood pressure, glucose, even scientists right now they're telling the first factor is the ATP will be also stopped to work. In this case, the hypoxia will be in totally very high level. In this case, the body will be fight to limit or to decrease the high amount of the CO2 and try to increase the oxygen. So, but when he couldn't even continue breathing or to re-intake more again the oxygen, so the body will stop to breathe. In this case, if there will be no CPR or any help, after 6 minutes can the victim or the patient be in a clinical death. And if there is no from the clinical death to 6 minutes will turn into the biological death. Here there is a type of treatment. Treatment can be medications from the doctor can write medications and patients may take it from the pharmacy. I will not speak about the type of medications. There is many. Surgical. There is right now many type of surgical. May it be the help for the patient to remove the pain or to recorrect the way function. Sometimes there is normal treatment or without medication or natural treatment, let me say, occupational therapy or physical therapy or psychotherapy, life modification, and so on. In the end, really thank you so much to listen to me. Here there is many websites can be very helpful for you to understand the pathophysiology, especially for Khan Academy. I can tell Medscape, Mayo Clinic. For books, there also here list of books. I believe it will be also very useful for you guys to read and enjoy reading and studying the pathophysiology. Thank you very much to listen, and I hope I will see you in the next time with a new topic from the pathophysiology. Have a good time.